Hello, my name is Brianna Rodriguez. I am a bachelor's student in the Human Services program with an addiction concentration. Today I will be discussing the family in 4 Good Days, and this is for the Addictions Family Counseling class. The addiction being addressed in this case is with Molly. She is the addicted family member in the family system, and she is struggling with substance abuse, specifically heroin. This started with a prescription for oxycodone when she was 17 years old due to a sprained knee from a water skiing accident. Some family roles within this family are Molly, the addicted family member, presenting as the scapegoat. The scapegoats are known as the black sheep of the family and are initially identified as the patient and present with addiction-related problems. Molly has multiple addiction-related problems such as homelessness, health problems, and losing her custody of children. Deb, who is Molly's mother, presents as the chief enabler. She has given Molly multiple chances, and each time she has been taken advantage of. She has been hurt multiple times by her daughter and struggles with her daughter's father's unwillingness to help keep Molly clean. She continuously crosses her own boundaries in order to help Molly. The next family member is Ashley, her sister. She presents as the family hero. Ashley is a lawyer who has a family of her own. Her mother mentions that she never has to worry about her. Ashley, however, struggles with feeling like she is not important to her mother because she puts all her efforts into Molly. Molly has been using drugs for 10 years. During this time, there has been no therapeutic intervention used, except for inpatient detox. Molly has been through 14 detoxes, and each time she has been unsuccessful in staying clean. An intervention that could have been beneficial for this family is the Clinical Family Addictions Interview. This assessment is designed to empower the addicted family member, orient immediate family members to the assessment process, jointly identify the addicted family member's strengths and attributes, gather data related to the addicted family member's addictive behavior, secure the family member's commitment to the addicted family member's treatment, and respond to the family's post-interview concerns. An example of this assessment with this family is the identification phase, which is the first phase of this interview. Here, the family identifies who should participate in the sessions. In this case, Molly's 2 children, Colton and Chloe, who are 10 and 8, are too young to participate. Molly's father, Dale, has distanced himself from her until she is clean. Her children's father uses drugs. These are examples of family members who would not be productive in her treatment. Members that could be helpful for this interview would be her mother, her stepfather, and her sister. Next, I'd like to address some theories that could be used with this family. First, I'd like to go over solution-focused therapy. Molly has verbalized her desire to change and has taken the first steps towards change. Molly appears to be in the contemplation stage of change initially. Solution-focused therapy would benefit Molly and the family because it focuses on the solution rather than the problem. Molly has mentioned some of her triggers being guilt and shame. She states, "My life is a trigger." By allowing Molly to work towards the solution rather than dwelling on her past, it may allow her to move forward in the stages of change. Solution-focused therapy interventions that would be helpful for this family are joining, which is discovering what the family hopes to achieve and how the therapist can help. Setting goals. This is to put together a treatment plan. This helps the family envision life without addiction. And scaling questions. This helps the family quantify their commitment, opinions, behaviors, and intentions. Another theory that can be used with this family is cognitive behavioral family therapy. Molly took the first steps in the action phase by getting the Vivitrol shot. The Vivitrol shot does not allow her to experience a high if she were to use heroin or any other opiate. Well, she did experience a slip and she has shown an increase in change talk. This step that takes getting high off the table allows her time to address precipitators to addictive behaviors with a clear head. Cognitive behavioral goals focus on understanding triggers and how they contribute to the addictive behavior, promote understanding of maladaptive behaviors, learn how behaviors are connected to positive and negative consequences, and explore healthier ways to function together as a family. Some interventions that would be useful with this family using cognitive behavioral family therapy are antecedents, which are events that precede other events. Here, Molly and her family can work together to expand on some of the triggers that Molly had mentioned previously. Those triggers were shame, guilt, and boredom. Together, they can create a trigger list and rate each one on a scale of 1 to 10. 1 being, I will not use after this event, and 10 being, I will definitely use after this event. They can also create a not use list, which includes situations, thoughts, and feelings that do not lead to Molly using. Another intervention with this theory is behaviors. Together, the family can identify primary and secondary reasons behind Molly's addictive behaviors, and they can together find healthier ways to meet the purpose of those behaviors. Next, I'd like to discuss some barriers working with this family. While Molly has displayed a desire for change, she also struggles with self-control. In order for her to get the Vivitrol shot, she needed to stay clean for 7 days. On her 4th day, she did have a slip, and when she got her shot, it caused her to go into precipitated withdrawal. Other barriers, a barrier to working with her is the possibility of her not utilizing her resources discussed during treatment. Other barriers include unwilling family participation as well as unsafe family members. Molly's father, Dale, does not want to participate in Molly's life unless she is clean, and he has mentioned that he does not want to do any of the work, and he believes that Molly must do the work. Here he is saying that he does not believe that there is anything that he can do to help Molly stay clean and that she needs to do it herself. So he would be unhelpful in this process. Another family member that is unsafe would be Molly's ex-boyfriend, who is the father of her children. Sean uses drugs, and he has used drugs with Molly and has asked Molly to get drugs for him. Molly does need to continue to interact with Sean. However, Sean is an unsafe person because of his drug use and his use with her. So Sean would not be a beneficial member in her treatment. Finally, I would like to go over some local resources for this family. A big resource that can be utilized by Molly would be support groups. Groups such as Alcoholics Anonymous and Narcotics Anonymous are based on the 12-step model. The premise of this model is that people can help one another achieve and maintain abstinence from substances of abuse, but that healing cannot come without people giving up their will to a higher power. This 12-step movement can be a powerful and helpful force for many people, but some people struggle with what they interpret as a strong religious element of the program. If that is something that Molly is struggling with, there are other support groups such as SMART Recovery. SMART stands for Self-Management and Recovery Training. This support group is based on scientific methods rather than on spirituality. And it has a heavy emphasis on self-empowerment, cognitive behavioral techniques, and coping with cravings. Other support groups that can be used by other members of the family are groups such as Al-Anonymous. This is a support group for individuals who are trying to navigate a loved one's addiction. Finally, the Vero Beach Recovery Center offers treatments such as group and family therapy, as well as outpatient programs and intensive outpatient programs that can be utilized by Molly, as well as Molly and her family.